Interview number 3, because you're doing 3 seminars this year.
Yeah.
First one, Jeffrey Stevens protocol, which is great. Second one, 3 Jeffrey Stevens techniques you have explained just a few minutes ago. And the third seminar is this one. Please describe the seminar very briefly. What is it about?
The SWAN is the seminar will be more than just the SWAN. The SWAN is the base of the seminar, but I will go more into communication with the subconscious mind, actually. So, but the way I describe the SWAN to my newbie students is it's a tool that you can't miss and that will make your life as a hypnotherapist so much easier. And I'm really happy that I had a chance to learn the SWAN quite in the beginning of my career as a hypnotherapist. And it made it so much easier for me, and it gave me a tool that opened up a lot of possibility.
Who is the seminar for? Who is it not for?
I think for hypnotherapists who wants to have something special and who wants to again make their life easier and also give their clients an experience. And I think that is one of the most important things for me. I use the SWAN as a preparation before a session. I can use it in a session. I can use it afterwards. I can use it even like a few days after the session online on Zoom. All things that I will explain in the seminar. But one of the biggest values of the SWAN is a client enters my office or a client is online on Zoom, and 5 minutes in the session, the client is already experiencing something. So they will have an experience, their hand is moving or maybe not moving that much. But one of the things, and I think that's the most important thing, and it's sometimes difficult for a hypnotherapist or for hypnotists to understand, is that the client is new to all this. And even if the client has only like a very small experience, for the client, that's something, whoa. For us as a hypnotherapist, it's from, oh, there's not much happening. It's a bit the same like when you do magnetic fingers and it's going really fast, or they are holding back, or when you do balloon and books, and sometimes they barely move, but in the client mind something happens, and they don't know that for some people it will move really fast or really big. So they will have an experience and it will make a click in their mind. And I find it so funny when I have somebody in my therapy room who's from the medical profession. So first of all, for those type of people, it's a big step to come to me, a non-medical person. So they have an issue and they decided to see a hypnotherapist who's not medically trained. And then they come into my office, and 5 minutes later, after we say hello and I have a few questions, and I start talking to their subconscious mind, but it's more like I'm talking to their hand. And I can see I can read their mind at that moment. In their mind, they have this conflict and they say, oh no, I choose the wrong person. I choose the wrong person. Because I'm talking to their subconscious mind, and I ask their hand to move their hand, and they are like they are trained for 7+ years in all medical, and they in their mind I see all these wires crossing, and they are like, okay, what is this guy for a fraud? And then all of a sudden the hand does this, and then you see them like, and at that moment there's a snap. You have them at that moment. Then they will have a wonderful result because something happens in their mind. They open up. Your hypnosis session will be so easy. They will snap into hypnosis. They will be the best client you can imagine, because you just prepare them with this. And this is only the SWAN. And in the seminar, we will go so many steps further. So we will add extras to the SWAN. I also came up with something, and I only had it for a few years. I came up with something that I can almost guarantee that if you have a person that doesn't have movement with the SWAN, that nothing is happening. I found a trick that you can do, and when you did that, you go back, the SWAN will work. And I came up with that few years ago, and since that I'm teaching this extra in the seminar, since that I'm using it myself, everybody reports to me, hey, that's working, that's really working, you found something to get through, because some of the people are analytic. I remember when I did my the SWAN training, when Bob introduced it, it's a technique designed by Bob Burns from Scotland. I'm a dedicated trainer for that technique. When he invited us to show the SWAN for the very first time to the world of hypnotherapists, he did the SWAN with me. And after 15 minutes, there was still no movement in my hand, because I'm a very analytical person. I'm always thinking, and then he had to do a little trick to get me out of my mind, and then the SWAN starts moving. But I found something that you can do in like 1 minute, and then it will start. You can do it online, you can do it in the therapy room, and it will work. So that's also something that I'm going to add to that seminar. And I will also show how you can combine the SWAN with Jeffrey Stevens protocol, but also with other protocols that you're using. So how you can use the SWAN to fix an issue with a client who's had a session a week ago and calls you up to say, I don't have much results. Can you come online for 5 minutes? Let's do something. And that little click can make the result for the client so much better. So there will be group swanning, how you can use it in demonstrations. When you, let's say you have a lecture for a service club, use the SWAN, the group demonstration. So everything will be covered in that seminar. It's a one day, this one.
So it's a great convincer that overcomes the biggest obstacle for hypnosis, the critical faculty being overactive.
Yeah.
And overcoming this hurdle opens the door and makes everything easy.
Yeah. And another, we spoke in the previous interview about working without formal hypnosis. Again, the SWAN, it's not hypnosis. You don't have to do an induction before you start using the SWAN. You can do it before the session. You can also use it in hypnosis, of course. And I will cover all those different ways of using or implementing the SWAN in your therapy or in your change work. But again, if you're a coach, if you're a nurse, if you're a doctor or a dentist, and you want to do something with a client who's anxious, you can do this. It's not hypnosis. You don't have to call it hypnosis. You just say, we're gonna do something fun. Let's play a game. And in my book, I wrote about that, about an 11-year-old girl who came to my therapy room with an eating disorder. She was afraid of hypnosis. I still don't understand why the parents booked a session with me, because I think the daughter also said it at home that she was afraid of going into hypnosis. But she was in my office anyway. She says, I have this problem. I want to get rid of it. But I don't want to be hypnotized. I say, okay, let's play a game. And in 1.5 minutes, I fixed that issue with the SWAN. 11 years, they had great reaction. And I fixed it. And a week later, the father came back, or 3 weeks later, the father came back with a son for a needle phobia. And he told me, after your session, that was barely a session, 1.5 minutes, he drove home and she started eating. Her issue was that nothing tasted good. She had always had everything tasted bad. And now she came home, she started eating, and since then, everything that the mother puts on the table, she was eating. So 1.5 minutes. So sometimes, yeah, so that's the good thing of this technique. You can do it everywhere. It's also a very good thing. If you're at a party and you want to start a conversation about hypnosis, let's say you want to promote your business a bit, but when you say, oh, is there somebody who's interested in being hypnotized, most of the time you don't find any candidates immediately. But if you say, oh, or people ask you a question about the hypnosis or subconscious mind, say, oh, let's do something. We're gonna play. Just gonna play a little game. But it will blow people's mind. And in the seminar, I will also show some other things that you can use, not specifically the SWAN, but other things. And I remember being in Thailand. We went to this cooking class, and people start asking, what do you do for a profession? And of course, the thing is, when you say hypnotherapist, and there were a lot of backpackers, young people. So 5 minutes later, I was doing stuff like SWAN and other things that I will show in the seminar. I didn't have to do a formal hypnosis session. I even didn't have to do like street hypnosis or something. No, I did something and they were asking my business cards. And that's sometimes enough. You don't have to always do big things or name amnesia or things like that. Just blow people's mind with something special.
You've mentioned it's good for physicians that have patients in fear, or if somebody doesn't want to be hypnotized. What are other benefits and applications for patients? Again,
it's very open, very versatile, because once you establish that communication with the subconscious mind, you can go wherever. But for example, let's say you do Jeffrey Stevens protocol, and at the end of the Jeffrey Stevens protocol, you have that acceptance. You ask your subconscious mind to accept these changes. But if you want to go a step further, and if you don't want to make it a one direction, if you say, okay, before you ask, normally you say not with your head if you accept and understand, but you can also take the SWAN. You can say, even if you don't have yes and no's, you don't need them, because with some people you can't get them that easy, or you don't have the time to install all these things. You just say, move the hand if you accept and understand. And one of the things that I do with stop smokers, for example, is sometimes instead of just nodding with the head, I say, okay, we're gonna put your hand like this. So subconscious mind, if you're willing to make sure that Vicky is now a non-smoker and you want to make all the changes, what I want you to do is move the hand like you did before. Move the hand towards her body, and when the hand is moving, you can give Vicky a bit of time to say goodbye to the Vicky, the smoker, and give her and introduce the Vicky, the non-smoker, and give her wonderful feelings and things like that. So it's something that you can add to every single protocol, to every single approach, for every single issue. And once you have that connection, it's open. I know a lot of people who use it a lot with parts therapy. They combine it with parts therapy, but then they get connection with all the different parts. But the good thing is it's more versatile than just having the fingers saying yes and no, because here you have much more movements that you can use.
We've talked about the percentage of theory, practice, demonstrations, and the first seminar, Jeffrey Stevens Protocol, 3 Jeffrey Stevens techniques are very hands-on. Yeah. What about this seminar?
This is really hands-on, because they're going to sit with a hand like this all the time. No, this is also, again, all my seminars are really hands-on. I really want people to experience what's going on. And one of the things, and that will happen for sure, and it happens all the time wherever I'm teaching this training, is that in the beginning, some of the students will not have much reaction, but that will grow. And during the day, they will get more and more reaction. And at the end, everybody will experience reaction. And that's also a good thing, because they will experience it themselves. And they will also have one very good benefit. We will also cover self-swanning, so they will be able to work with themselves with the SWAN as well.
Wonderful. That's a great benefit. What is for you the reason that you say, I need to teach this technique? Or another question before, if somebody says, I'm working with idiomotor signals, why would I need another technique?
Yeah, because it's much more than that. If you already work with signals, then what I think is the benefit, and that's actually what the SWAN, but the original SWAN was only there was not the fingers that came later. But just using the SWAN before your session is the biggest benefit you can ever imagine. And I think when I teach newbies in Belgium, after the 7-day training, they always ask me, what's next? What if we have, let's say I have 5 different trainings, and they say if you would recommend two of those trainings that we should follow to make our practice better, what would you suggest? And I will always tell them the same thing. I would say do that one day SWAN, because it will make your life so much easier. It will prepare your clients so much better for a session when you do it before the session. So that doesn't have to do anything with, you don't need a yes, you don't need a no. It's just an installation of the SWAN that will just make it, the click in their mind will be enough to make it a better client and to have better results at the end. And the second one that I always mention is virtual gastric band, but that's much more, that's more like a business reason, because that's very popular and that will fill up your hypnotherapy practice. But by making your life easier, making your skills as a hypnotherapist better, the SWAN, that's the one that I always suggest, do that training.
Mm-hmm. So many benefits for therapists, for coaches, so many benefits for patients and clients. If someone, after hearing all this, is still undecided, what would be your answer?
Well, I would say if you want something that will, if you're like, and I know a lot of hypnotherapists are like this, most of them, they don't have like skills in entertainment hypnosis. So what they lack a bit is the experience or the client having an experience. So they hypnotize the client goes outside, and sometimes the client is still doubting, was I hypnotized, was I not? Some hypnotherapists are using like convincers in their session, like they have like a hand stick or something. I don't do that, because when I do the SWAN before the session, I don't need to do anything like that anymore, because my client experienced already something while they were still conscious, while they were not hypnotized. Their hand was moving, their hand was doing things that they couldn't control. So why would I still do something like a convincer in my session? I don't need it anymore. The client who comes into your room and has this movement, after he knows that something will happen during the session, because this is not normal. They are like, what's this? So you see them change, and so it will make your session so much better. So if you look for something to make it a bit more fun also in the therapy room, to blow your client's mind, to make your client a better hypnotist, don't doubt, and just and again, like I said, it will be a breakthrough for yourself as well, because you will also have the ability to control your hand with your mind and ask it questions, and yeah.
Wonderful. And the seminars with you are great fun. So thank you for
that's really important. I think it's really important to make a bit of fun as well while teaching, and also while doing hypnotherapy. There's no reason why it can't be a bit funny in the therapy room as well.
Exactly. So I'm looking forward to the next Jeffrey Stevens Protocol seminar, because I know it's great. And of course, I'm looking forward to the two other seminars, and I'm looking forward to meeting you in person again. Again, was great talking with you. Thank you so much, and see you soon.
I'm also looking forward to be a full week in Magdeburg again, and teaching in your wonderful institute for your wonderful students.